regarding this infrastructure problem. Then another factor is, apart from the low digital literacy in the patients, also there are low literacy rates in clinicians and the staff. They lack adequate training in using the digital tools. So it's a big challenge, training the hospital staff, doctors, because there is a lot of resistance, to the changes, to the workflow changes, and there is a fear of increased workload for the which slows the adoption, because they're not, they don't readily accept this change. A doctor who is not used to using the devices, who is not very tech savvy, so there's a lot of challenge in training those people. Even the staff, they think that it is an extra burden, and apart from their routine work, they have to spend time in all this. So this is a big challenge and a big barrier again. Of course, regulatory and regulations and compliance again are, one of the major challenges with the strict data protection norms, DPDP Act, which has come now, and the medical legal liabilities are increasing, and also there is the lack of standardized policies which complicate implementation. So concerns over the patient privacy, liability, and accreditation, because for accreditation also is now there are standards for digital health in NABH which has come up. When I became an assessor in 2006, first batch, we only had one program for the hospitals. Now NABH has come out with 18 programs. Recent one being the digital health standards for the hospitals. So this is again a challenge. And not only that, the NABH has come up with the standards for the vendors. So even the vendor has to be, NABH compliant. So these are again, the barriers, of course. So I think all these factors, of course, cost, which also Dr. Ravi very rightly mentioned, and there's an upfront investment cost, and people are confused. We when you start implementing digital health tools, you start with basic HMIS and EMR. Even for the ABTM, you need to have the basics in place, the electrical health record, and the HMIS. So telemedicine platforms, AI tools, cybersecurity infrastructure, there's a major barrier. And also the cost, if you look at the cost, is ongoing maintenance cost and upgrading the further in, the system, which increases the financial burden, because you cannot stay at, there, and you need to upgrade your systems, which also increases financial burden. These are the cost and affordability, especially for the small and mid-sized hospitals. Yeah.
I understand. Thank you so much. Actually, uh, this trust can be built only with a better, scalable, affordable, user-friendly healthcare solutions,
Yeah.
which actually leads me to the question to Mr. Sumit. So, how that can be ensured is to be confirmed from Mr. Sumit only. Mr. Sumit, this is my next question to you. So, how do you ensure data security, privacy, and trust while building scalable healthcare solutions?
So, in terms of ensuring data security, privacy, and trust, whilst building scalable healthcare solutions, is obviously it's one of the biggest modern challenges from a tech perspective, um, because that requires a lot of long-term strategic thinking as well as quite deep investments from solution providers like us, and ensuring collaboration with the actual users to ensure we've got the right feedback. We are covered under the right regimes of regulatory controls, and also we are delivering the solution that's going to deliver value to the end users. Now, if you look at each of the topics one by one, the first one is around data security. In that space, there's a lot of encryption, access control, and ensuring alignment with regulations such as DPDP Act in India, HIPAA in the US, GDPR in the UK and Europe. They're all required, and depending on the nature of the solution, all or some of this is potentially applicable to how the solution has been created, how the data guardrails have been uh, sort of inserted in the solution, and how the interactions with the regulators as well as end customers are happening. Why this is important? Um, the key primary reason is that we are working with quite detailed, personalized data, what we call as PIIs, in terms of data protection. And in that space, it's important to treat the data as sacrosanct and ensure that the personal information on the data is not utilized. Wherever data is being used to train the AI models and so on, are clearly declared back to the patients that the data will be used for certain training purposes. Will remove the personal information, keep it anonymized, and obfuscate the personal information from the data sets. So once we've gone through the encryption and access control, which in my view is the most basic aspect of data that needs to be taken care of before it's fed into any kind of solution, then comes the approvals. And uh, in that space, I'm targeting the most specific regulatory compliance and certifications. Again, the importance of having the right kind of regulatory compliance and certifications lies in the fact that it delivers trust to everyone in the ecosystem, and is the simplest way to uh, give assurance back to the patients as well as service providers and our highly esteemed doctors that the solution is not going to create any issues for the patients. The data usage is within the realms of the regulatory guidance, and then it gives regulators a lot of confidence on the solution and the company, and companies like us, that we are adhering to the norms and the guidance issued by the regulatory bodies. Anonymization and de-identification, we've already covered that in terms of how the data is being treated, and it's part of the overall encryption, access control, cleaning up the data. And then finally, we also need to be aware of the audit trails and monitoring, and this is how we deliver trust across the board. What that means is we cannot take the certification once and be happy that the certification would be sufficient for the next few years to come. Typically, there is a recertification cycle that most of the regulators come in with, and their requirements would state that every year you need to get certified with, let's say, DPDP Act, or in Europe, there is a new act that's emerging, AIA, or there are further certifications that the solution can have around ISO 27001. For each of these, it's not so much around the certification, which obviously is the end game, but it's the continuous monitoring, continuous assurance on the audit trail and availability of those audit trails and monitoring on the solution itself, which is quite important. So, all in all, ensuring the data security, the privacy, and trust within solutions, the AI solutions, is becoming more and more important, and it's becoming more and more complex as well.
Great. Thank you. Thanks for that elaborated and insightful information, and actually bringing the reassurance to build a scalable and the trustworthy and scalable solutions for healthcare. I would like to hear now from Dr. Ray. Dr. Ray, this question is to you. It's from a different perspective. So I think that would make sense overall. From your perspective, how do you think can hospitals and healthcare organizations evaluate ROI when investing in digital health technologies?
It's a quite relevant question. The other panelists have already highlighted
Yes.
to invest on digitalization, the institutions, organizations are spending a huge amount of money. So most of them will try to measure the ROI based on the first the financial metrics. So if I'm investing this much amount of money on these digitalization platforms, so what am I getting in back? So what is my overall amount of money that I am getting? So that is the financial metrics overall. But from the other point of view, if I look into this, so we can look into something like the patient experience from all this digitalization. So because if we can cater to a patient properly through this digital means, so I think they can repeat, they can come to our hospital again and again. And so that is one way of measuring. So the patient experience can be enhanced by use of digital tools. So something like suppose nowadays we have different tools to also measure. So if suppose a patient is visiting the hospital today and the patient and based on the various tests that the patient goes through, all the tests can get recorded in the same platform. And then if suppose the test can predict that, okay, after this many amount of days, the patient needs to visit again, and the reminder can be sent to the patient automatically. So that is how the patient engagement can be more and the patient experience can be better. Sometimes what happens is that nowadays we see different apps are also present. I also have some apps like that as well for different companies or healthcare organizations. So where if suppose there is a medicine that I am taking and they feel that okay, the medicine is about to the number of medicine that I have ordered earlier is about to expire. So then they will send a reminder that do you want to purchase this medicine again? Or do you want to purchase go for this health checkup again? Do you want to go for this blood test again? So that is how they send a reminder that okay, you had got this disease. So do you want to have that check again? So I think the patient metrics is now becoming more important because nowadays within the services industries and looking after the patient, the personalization is becoming very important rather than the financial metric. That is my perspective. Apart from this, because of digitalization, there is one more issue that the healthcare organization used to face was related to operation. So the operational issues, are they able to cater to those? So based on the objectives that they had earlier said, in order to buy these different digital platforms, so are they able to solve the different operational issues? So that can be another metric. So something like the resource management. So to cater to the patient, suppose between night 11 p.m. till the morning, how many resources are needed? If there is a high demand of patients, are there available beds or not? And to then tell the patients who are trying to come to a hospital that no, our beds are full, so can you please go to a nearby hospital which is about something like 3 kilometers away from our hospital, or our hospital does not provide these services, can you go to the nearby hospital? If these things can be done, I think the amount of cases or the burden on a particular hospital can also be reduced. So it's now not only about the financial metrics, we're looking something like the patient metrics as well as operational metrics. Something like the clinical metrics will also come into the picture. And sometimes it also happens that suppose I have implemented a particular digital platform in my particular hospital, suppose a chatbot, then I will be able to also measure that if this chatbot is able to reduce the amount of workload that my admin people used to have, and is it able to maintain the quality of how it is responding to the patients well or not? So the quality aspects will also come into the picture. Is my digital systems able to maintain the exact quality that my earlier traditional ways of doing was actually do having? So I think these are some of the metrics that will help to measure ROI over a period of time in the healthcare segment. So thank
Right,
you.
that's exactly where Gravitas AI plays a role in striving to
Yeah.
achieve that kind of patient support. So my next question to Dr. Ravi. Dr. Ravi, we heard from Dr. Ketapal talking about the government bodies, hospital associations. So, from your industry perspective, so how do you see your industry working with these bodies to scale adoption?
Come again. Okay.
Yeah, yeah. I was asking about how do you see your industry working with these bodies, that is, government bodies, to scale adoption?
Okay. So, Chitra, I would say from our company perspective, why the company excites me more to work with Involution Healthcare and the medical devices industry is because it's how our labs are moving from being pure hardware setup, hardware setup, the earlier devices, and now they are becoming a more intelligent and the data driven ecosystem. Uh, so our focus at the company is that we making the labs and systems that are world class yet designed for the India's reality. That's what you are saying about the adoption in the hospital. So until you make the unit and the system which is friendly for the doctors for the operations and ease of working, you will not be succeed in India. So you need to keep in mind the India's reality and India's healthcare infrastructure. So considering that, we have actually built the labs that rival the global benchmarks also in the imaging and precision, but at the fraction of cost to ensure that access to the tier 2 and tier 3 cities are not just and not just the only big corporate hospitals. Now, in terms of adoption to the hospital, uh, I would say there are a lot of new technologies being coming up in terms of our solution. Also, AI is coming in the imaging segment. In the teleradiology, we already heard, but in the labs also, we working on the AI assisted imaging, which helps the doctors detects blockage more accurately with better contrast optimization, the real time hypodermic hemodynamic data analysis, automatic reporting modules, and AI supported IV image interpretations and all. So honestly, it is quite positive at the hospitals level also. Today, I think I would say we have more than 500 labs installed, and the doctors actually tell us the appeal is not just the affordability, but the fact that we have made the user interface very intuitive and the workflow is very familiar. Now, if we will add the artificial intelligence layer on top of that, then that is something which they are keen to try on, and provided it integrates seamlessly into the workflow system and doesn't slow them down. So now, if we talk about the younger generation doctors, so on a global level, AI in the labs actually showing a lot of promising results. For example, there is a research which shows that AI can actually enhance the lesion assessment and suggest the stent sizing with a very high accuracy. And if we talk about the Indian cardiologists, they are very open to this, especially to the younger generation doctors, which actually who actually wants tools to support, the faster evidence-based decisions. So, in short, I would say our labs are no longer just labs or any other system. They are not just, no longer they are just steel and hardwares and monitors. They are actually evolving into smart, supportive partners for the doctors. And that's why the adoption and the receptivity is very high, because every clinician wants the accuracy, efficiency, and safety altogether. So if the technology gives them all without hampering or complicating their life and delaying their workflow, they would love to embrace it. So at Involution, I would say our goal is, with any medtech equipment company, the goal is not to replace the doctor's judgment or the doctors. It is to, with AI, it is to just give them a trusted assistant or a partner inside the system, so that they can more focus on saving the lives of the patients. That's how the
Actually, I
adoption.
would like to get more additional view on these to add to that. So, do you think these tech and digital healthcare will dominate in the next, in the future, in the next, let's say, 5 years or 3 years? Uh, in fact, what trends do you think will dominate? AI-enabled devices, remote monitoring, robotics. What do you think?
So, Chitra rightly said the future cannot be shaped by one technology in isolation. It is the convergence of AI, the remote monitoring, and the robotics also, which is coming at a very large scale in India also. So, all working together in a connected ecosystem can change the future of healthcare in the AI and robotics also. Uh, Let me just start with AI. So, as you have also mentioned in your opening remarks, that it's already here and not futuristic anymore.
Yes.
So,
Yes.
I think the US FDA has cleared more than 1,200 AI enabled medical devices, which are mostly in the imaging segment. But now we are saying AI is expanding into a lot of other segments of the healthcare delivery also, and the diseases also like cardiology and pathology. So, and I like to describe AI in healthcare as a second pair of expert eyes, because we have started with the second opinion of artificial intelligence and the teleradiology things and all. So, for example, in cath lab, AI can actually enhance the angiography images, which can actually help size the stents more accurately, or even flag sometimes the subtle vessels which can, vessel changes that a human eye cannot might overlook sometimes. So it's like having a silent partner assisting the doctor in real time, just like the Indian government being a silent partner in your income. Same thing. I think just to lighten the thing, the AI can be a silent partner assisting the doctor in real time. So now, then from AI, if we can talk about the remote monitoring, we have already know the effect and the adoption during the COVID time. Uh, Now also a cardiologist from tier 2 city once told me that he was actually managing more patients on WhatsApp than in his OPD and through teleconsultation. So that is when it becomes very clear that remote care is no longer an option; it is now a necessity. Globally, also the hospitals are adopting the hospital at home models. Um, in India, Dr. Khetrapal gave some figures in his first question. So when we talk about the digital rails, the ABA IDs have already been created for more than 80 crore citizens. The In Sanjeevani data, Dr. Khetrapal says more than 34 crore consultations have been done, more than 800 million internet users we have, most of them in the rural areas. This means that we can actually leapfrog the adoption. I mean, imaging a heart patient after a stent procedure being monitored continuously at home with real time alerts to their doctors. So that's what the remote monitoring will look like in the next 5 years. So now we talked about AI, then the remote monitoring, and now if it comes to the robotics. So I think right now I think India has more than 220 surgical robotics, mostly concentrated in the metro hospitals right now. Uh, Usually, I compare the robotic things with the aviation because initially only a few premium airlines had the autopilots, but over the time it becomes the standard. So robotics is actually following the same curve, at and as the cost actually come down and the training expands through a lot of government initiatives also, and with the PPP, public private partnerships also, we will be seeing how the robotics will move into the tier 2 cities and mid-sized hospitals. I just give you a live example of one of the India's robotic company, the SS Innovation. They have actually started the robotic bus. So the bus travel to different cities and process and do the robotic procedures, where the doctors will be either sitting in the bus or in the remote areas. So this is actually the story, I would say, is the democratization of precision, where where a patient in any remote any areas like Indore, Coimbatore, wherever he is, being able to access the robotic assisted cardiac procedures at an affordable cost. Now, in all these things, we talk about AI, we talk about remote monitoring, we talk about robotics. Out of all these, the most exciting part is how the integration will be done. So, just picture this: a heart patient gets a stent in tier two cities, tier two hospital, and once he is at home, wearable devices on his wrist can continuously track his vitals, and AI analyze that data, flags an early risk of restenosis after stenting, and the doctors sitting at the remote hospital can actually see those live tracking of the data on his dashboard. Though, and the data will securely flow through an ABA ID, our government created ABA ID. So, if an intervention is needed, the robotic will ultimately do the procedure, I mean the procedures. So here you see the integration of AI, integration of monitoring, and then integration of robotic system from start to end. So this is what the future I think we are heading towards, where the healthcare that is precise, predictive, and I think personalized. So, in nutshell, I would say that when we look at the next 5 years, it is not only about the gadgets, but it is the whole ecosystem, as I have explained. The
Definitely.
and the winners will be those who will actually integrate the AI, the monitoring and robotics into the trusted use and accessible solutions that actually makes the difference, not just for the metros, but across the country, across the Bharat.
Definitely,
Thank
definitely. Thanks for giving that elaborated understanding. But that's from the industry perspective. I would like to know from the healthcare perspective, which leads me to ask Dr. Kirtipal. So, what do you think? Are the hospitals ready to adopt these technologies at scale, or is the gap still wide? Dr. Kirtipal, you are on mute.
Yeah, Chitra, this question is for me.
Yes, doctor. So we have heard from Dr. Ravi on giving an elaborated understanding about the key trends like AI-enabled devices, remote monitoring, robotics, etc., in medical technology and digital healthcare. He also mentioned how this will dominate in the next 5 years. So I just want to know from the hospital perspective whether hospitals are ready to adopt these technologies at scale or is the gap still wide?
See, as from the hospital perspective, hospitals are willing and ready to adopt, provided that we address their issues and challenges. Uh, because the hospital needs a very user-friendly solution, and which is beneficial for the hospital, for the provider, for the doctor, and most importantly for the patient, which is the most important stakeholder in the healthcare landscape. So, but there are challenges. Now, as I already mentioned in my previous question you have asked about the capacity building and training. So once the staff is trained, and there is, first of all, there has to be commitment from the leadership, from the top management. The leader has to be committed. The top management has to get involved and then constitute a team so that you know uh, take everybody along so that the adoption and implementation is easier. The hospitals are not adverse to adopting digital health. It all depends where the hospital is located, whether the hospital is located in tier 1 city, tier 2, or tier 3 city. They are there to willing to adopt, but problem is they are not aware of so many things. They are actually confused. There are so many vendors, there are so many solutions. So we need to provide them with an affordable and user-friendly solution, which is actually, which will definitely, which should increase the operational efficiency and outcome of the patient. For to give you an example, just I remember when I was in Max Healthcare, I joined in 2001. That is 25 years, almost 25 years back. So Max Healthcare was using EMR from day one. From day one, I was very fascinated by EMR. I had never seen it before. So in 2001, I also started using EMR, and then I became an EMR champion. I started training the doctors on EMR, the senior consultants and doctors. So then I was like, oh, this is something, which every hospital should have. But then constraints are there, right? And hospitals, over the last 10 years, you see even that there is, because of ABDM or, whatever reason, so many small hospitals in tier 2, tier 3 cities are now willing to adopt digital health solution, and they are adopting. They are also trying to overcome the challenges. So I think hospitals are not averse to adopting the digital health. The only thing is that they need to be guided properly. They should be educated. The leaders, the top management has to be committed. All the staff should be involved, and we should tell them about the benefit of these solutions. Right? Patients also should be educated on these tools. Right? How is it going to benefit you? Remote monitoring, all the digital health tools, teleconsultation, especially the I mean the after the discharge. Teleconsultation has no role in emergency. It has a role in follow-up cases. Great role. First visit also, patient should visit the hospital, right? But then follow-up visit, and but in rural area, of course, you can have teleconsultation anytime. But then hospitals are now actually getting more and more aware, more and more educated, and they are very much willing. They are adopting. Even the vendors now, the companies, they are bringing up with very tech savvy, a very robust systems, but user friendly systems, and which are actually easy to implement. Okay, implementation will always remain a challenge, and then the most challenging part is the monitoring part. We want to implement, and we are not able to do it in letter and spirit. We are not able to monitor, then you end up nowhere. So there is no use. So you need to have a structured program for the implementation of your digital health solution. It has to be a policy decision. Digital health implementation should be a policy decision, right? And I should say rather it should be integrated in your vision and mission statement, that you know how, how you are going to serve the people. So I think uh, hospitals are very much willing, and there are hospitals who are actually doing very well in here. The totally automated hospitals are there. They're into total automation, and like I personally involved in training of doctors and the hospital on digital health masterclass. This course was developed by Koita Foundation and PwC, and I personally, I'm a trainer, I'm a faculty for that because I did digital health certified course from IIM Raipur. So I went to 6 states, because we have 20 state chapters. AHPI's bandwidth, we have 20 state chapters. We have 15,000 plus hospitals. So I went to different states and trained people on masterclass, all the hospital leaders, CIOs, operations head. This is just on basics on HMIs and EMR. So once you have the digital literacy program in place, you educate people, then then they start thinking, okay, now we need to adopt, and there is no other way.
Okay, thank you. Thank you. That's great. Actually, that leads me to the question to Dr. Ray, in fact. So, Dr. Ray, you heard Dr. Ketapal. So, from your perspective, from your end, can you tell us what role does the education institutions play in preparing the future health leaders? to navigate digitalization and AI-driven healthcare system. Can you briefly help us out understand that?
Uh, so from the educational point of view, from the management education to be more specific, so whatever Dr. Ravi and Dr. Khatipal have said, so something like managing those resources and then how to adapt to the changes that are taking place so rapidly. So there is one important field that is coming up is more about the change management and the diffusion of technology. So diffusion of innovation also has a very important role, but sometimes people fear that whether AI will take up jobs, AI will have some role to play in that or not, and how much will it be? So something like accurate or not in the different segments, suppose in the sensitive segments or not. So because of this, there is something on a change management which has to be done properly, because for which training needs to be given to them. Uh, One thing is that the training has to be curated across the different verticals of healthcare. So from the doctors, from the admin people, from the different helper segments. So there for that different segments, different types of programs has to be divided. And one more thing is that there are two aspects in this as well. So one is the technical skills as well as the managerial skills. So these two things has to be also taken care of. So from the management point of view, management education point of view, so the training can be given on some courses, something like as I talked earlier about the financial metrics. So financial aspects can be taught, something like the operational metrics. So for that case, something like the operation subject, the supply chain, how digitalization is helping in those segments, and also something like whenever there is some risk, so the process management has to be of good quality. So this process management part can be another segment. And also with AI coming into the picture, because people are talking about precision, people are talking about the accuracy of things. So how to train it properly so that it can give more precise results. So these things has to be also taken care of. So that is why AI skills is also important. This is a technical skill. And for the managerial skills, also you have some subjects like HR management. So because of the so many resources present in the even a single hospital segment or the hospital chains, you can understand. So the HR aspects also needs to be taken care of. So something like the package that has to be given, something like how to manage the resources. If there is someone who is having a lot of load working for something like 14 hours throughout the day, will that person be able to cater to the different patients properly or not? So those things can also be taken care of by digitalization. Now with so many things coming up, so as Sumit ji has also mentioned earlier, there is also a risk about the PII and SPII. The cybersecurity aspects needs to be also taken care of in the training process. And one more thing is that because people are adopting these technologies now in India, the robotic surgeries are taking place with a small, minute hole and then doing the surgery through that. So the precision has improved, but people are also fearing what is about the privacy of people, privacy of patient records. So I think a proper training, proper guidance across all the healthcare verticals, whoever the stakeholders are, so it will then help those people. It will then help the people to recognize the importance of AI as well as understand what all should be done so that the privacy risks can be reduced to as much as possible. So I think these are the few things that a management education can help different people in the different verticals of the healthcare segment.
Great, great.
Thank you.
Thanks for that answer. So we are at the end of the session, and I have one final question, which I can get the answers from all of our wonderful panelists. Um, so, considering the time constraints, I would appreciate the answer to be very short for this question. First off, to Mr. Sumit. Mr. Sumit, please tell us where do you see AI in healthcare evolving over the next 3 years? Which areas will benefit the most? Diagnostics, surgical equipment, patient management, or others?
Thank you, Chitra. Um, Further to some of the comments that Dr. Rathore has made earlier on, it's going to be all encompassing because of the nature of the technology, also the maturity curve at which the technology is right now. And AI is one of the leading technologies, but not the only technology that's shaping up the healthcare management as we move forward. So, in terms of where do I personally see AI sort of furthering the support to healthcare professionals, doctors, and the patients, it would be in all areas, and it would exceed just the diagnostics, just patient management, just surgical equipment. It will also start becoming uh, cross topical as well. What I mean by that is uh, AI utilizing diagnostics in, let's say, hematology, or AI imaging, predictive analytics, early disease detection would also lead to the information exchange with the AI that's driving the surgical equipment through robotics, robotic assisted surgeries, precision tools, and then it would then further the engagement with the patients at the patient management level. And we've seen that through multiple solutions that both we deliver as well as our competitors deliver to the market, such as the remote monitoring, AI chatbots, personalized treatment plans, and so on. There would be multiple new horizons that will also start opening up, in my view, and they would be around the way patients interact with the healthcare professionals, how they manage their data, and how the data control is given back to the patients in the times to come.
Okay,
In
thanks for that.
summary, I believe it's not going to
Sorry.
be, in summary,
Yeah,
Chitra
yeah,
and
please, please, please. Please.
rest of
Sorry.
our panelists, I don't think it's going to be limiting in any way. In fact, it's only going to expand our horizons and deliver better accuracy as we move forward, and keep supporting our healthcare professionals, our doctors, the hospitals, to deliver better outcomes for our patients. Thank you.
Thank you. Sorry to put you like that. What is your view, Doctor Rathod? Uh,
You're asking me, Chaitra?
Doctor Rathod, yes.
Yeah. Sorry. So hi. So just a crisp answer, I would say. In the next 3 to 5 years, I would really like to see that AI will have a very big impact on few of the sectors like diagnostics and imaging, the remote monitoring of the chronic diseases, which we are actually seeing right now also. On the clinician perspective, it will have a bigger impact in the clinical decision support and the workflow automation. Because in all of this, the speed, accuracy, and the workflow shortage is very critical right now. If we see the sectors like radiology, pathology, and ophthalmology, these sectors are those sectors who will see the very fast and more accurate diagnosis. Now, if we talk about the AI-enabled wearables, which is now enhancing at a very fast pace, they will be actually enabling the proactive care. The hospitals will benefit from risk prediction. Now, apart from this healthcare side, if we look at the R&D perspective, then the drug discovery, genomics, the precision medicine, they are also advancing. They have a broader clinical impact. Uh, it will take some time to mature. It will take some time, slight longer to mature, but it will come in future, maybe next 2 to 3 to 5 years. Thank you.
Okay, okay. Thank you. Dr. Ray, from your academic perspective, please.
So I feel that it will have AI will have a very big impact on all the segments. So diagnostics, patient management, surgical equipment, so all the segments in the next 3 years. But still now we have not seen what all new technologies will again come up. So in top of it might be a new technology coming up which can have better impact on the healthcare segment. But AI will be there and will help in different, and it will over time it will also be able to give more precise results, as well as the prediction power of it will improve over time as well. Diagnostics and patient management will be the most important segments, according to me, where AI will have a very big impact. Uh, I'm not saying that it will not have a good impact on the other segments as well, but on these two segments, I feel it will have a very big impact.
Great. Thank you so much. I'm really happy to have you all today, and we are at the end of the session. And it was very insightful and informative and reassuring discussion today. So, thank you all for your time. And as we wrap up part three of this continuing series, what today's discussion reinforces is that while the theme is constant, the perspectives are ever evolving. So we heard, seen, and understood few things. So we heard how industry is innovating rapidly. We've seen how academia is preparing future generation industry ready. We've also understood the ground realities from healthcare providers and medtech innovators. So each panel in these series adds another piece to the puzzle. So and today our panelists have reminded us that collaboration isn't a one-time effort. It's an ongoing process of learning, adapting, and co-creating solutions that work in real-world healthcare settings. So, as this series progresses, let's take today's insights not as repetition, but as refinement, sharpening our collective understanding of how to make AI strategies truly effective in healthcare. A big thank you to all our wonderful panelists today for bringing fresh energy and perspectives, and also to our audiences who have been part of this series and following us on all social media. Thank you so much for the support, and thanks for being part of this continuing journey. Thank you very much for all your time. Thanks a lot, gentlemen.
Thank you,
Thank
Chitra.
you, Chitra.
Thank you, everyone.
It was
Thank
a
you,
pleasure.
Chitra. Thank
Thanks,
you,
Thanks.
everyone.
everyone. Bye.
Thank you.